The purpose of this phase is to implement the action. Check or study. Check phase is the review phase, where all your efforts will make you move from doing reporting to doing analysis. Let's understand the third phase of the PDCA model, that is check, with the help of an example. Delays in the placement of catheters used in intravenous therapy were causing increased lengths of stay and decreased satisfaction among many patients.
We need to properly conduct an improvement cycle on PICC insertion wait time.
Can you please check on the issue of excessive wait time for PICC insertion?
Proper checking of the process is required as it will help in identifying the major flaws which is causing the problem. Actually, to begin improvement planning, we have to check first that whether there are several complaints or not. Then only it would be appropriate to perform a valid data collection to calculate the statistically accurate mean wait time.
Further, if a problem is detected and improvement strategies are implemented, we will check or study its result by collecting wait time data.
There are several cases of excessive wait time of PICC insertion. You can begin with the data collection process.
The data was checked and analyzed. New plans were further implemented to solve the problem. Not only it reduced the overall waiting time for PICC insertion, but also eliminated communication problems between various departments.
Act. This phase marks the culmination of the planning, testing and analysis regarding whether the desired improvement was achieved as articulated in the aim statement. The purpose is to act on what has been learned.
Phases of the PDCA model. PDCA model benefits companies by providing a systematic approach to achieving continuous improvement. The objective is to continually progress through each stage while aiming to achieve a better quality output of products or services or information. The Deming cycle is often phrased in the change management process and in business improvement fields as the PDCA cycle. It is often graphically presented as a circle or wheel because it requires repeating the same stages over and over in the continuous change management effort to improve processes and outputs. The circle is represented in 4 quadrants of Plan, Do, Check, Act. Other variations to the name include Deming circle, Deming wheel, Deming quality wheel and Deming management wheel. PDCA offers a data-based framework based on the scientific method. This simple yet powerful format drives continuous and ongoing efforts to achieve measurable improvements in the efficiency, effectiveness, performance, accountability, outcomes, and other indicators of quality in services or processes which achieve equity and improve the health of the community. Plan and improvement. The goal at this stage is to decide what needs to be done and how it can be done in best possible manner. Achieve this goal by reviewing and studying the current work process and available data. This stage really involves examining the current method or the problem area. Do the planned activity. Implement the improvement or problem-solving plan by actually doing it. This is the implementation stage during which the plan is actually tried out in the operation. The people responsible need to be trained and equipped with the resources necessary to complete the task. Check the results. The new implemented solution is evaluated to see whether it has resulted in the expected performance improvement. Analyze the new data available and measure the results to see if the implementation of the plan is giving the results that it should. Act on the results. If the implementation was successful, standardize and document the work and new processes. If the change were not successful, learn what we can from the trial. adjust when necessary to overcome problems, and formalize the new knowledge before starting the PDCA cycle over again. During the act phase of the cycle, the team must decide whether to move forward with the changes that were made, incorporating them fully into the organization's structure, policies, procedures, and educational processes. If the do phase was a pilot test, the changes made are tested during the check phase. If they were found to be successful, the changes made would then be incorporated system-wide throughout the hospital or home care company. The changes that brought about improvements should be phased into all applicable areas of the organization as part of its standard operating procedures. Phases of PDCA model. In a central process, the actual results of an action are compared with a target or a set point. The difference between the two is then mentioned and corrective measures are adopted if the disparity becomes large. The repeated and continuous nature of continuous improvement follows this usual definition of control and is represented by the PDCA, Plan, Do, Check, Act cycle. This is also referred to as the Deming Circle, named after W. E. Deming. Another variation of PDCA is PDSA, Plan, Do, Study, Act. The application of the PDCA cycle has been found more effective than adopting the right first time approach. Using of the PDCA cycle means continuously looking for better methods of improvement. The PDCA cycle is effective in both doing a job and managing a program. The PDCA cycle enables two types of corrective action, temporary and permanent. The temporary action is aimed at results by practically tackling and fixing the problem. The permanent corrective action, on the other hand, consists of investigating and eliminating the root causes and thus targeting the sustainability of the improved process. The aspects of the PDCA cycle were applied to internal quality assurance procedures. A. What are we trying to accomplish? B. How will we know that a change is an improvement? C. What changes can we make to improve? Advanced PDCA cycle shows PDCA cycle in detail. In the do stage or implementation stage, it is possible to involve a mini PDCA cycle until the issues of implementation are resolved. The PDCA cycle is more than just a tool. It is a concept of continuous improvement processes embedded in the organization's culture. The most important aspect of PDCA lies in the act stage after the completion of a project, when the cycle starts again for the further improvement. Let's discuss a case study that demonstrates an action research based series of PDCA cycles which have been instituted within a busy country general practice GP in South Australia. There it was found that the delivery of evidence-based psychiatric care in general practice is difficult. A number of barriers exist to effective care, and even at times the behavioral disturbances of the patients also create problems for the orderly conduct of general practice at times. So, a PDCA cycle was developed in a sustainable way for patients with mental health problems which provide evidence-based, coordinated and planned care that is monitored according to a care plan. Planning was done. A decision was made to apply for a practice development grant. Later on, the new initiative was for the nurse to work more closely with the psychiatrist at the time of the visit. The Division of General Practice conducted a qualitative evaluation of the project. After 3 months of using the new system, all patients were being followed through by the practice for the development of a care plan. Finally, the new system was successfully implemented. It was agreed by the partners at 3 months that this arrangement was in fact financially viable and practicable in terms of space and demands.
Summary. This module summarizes that the Deming cycle or PDCA cycle is a continuous quality improvement model consisting out of a logical sequence of 4 repetitive steps for continuous improvement and learning. That is, plan, do, check, and act. The PDCA cycle or PDCA cycle is also known as the Deming cycle, the Deming wheel of continuous improvement spiral. The concept of PDCA cycle was originally developed by Walter Sheward, the pioneering statistician who developed statistical process control in the Bell Laboratories in the US during the 1930s. It is often referred as the Sheward cycle. PDCA cycle emphasizes as well as demonstrates that improvement programs must start with careful planning, must result in effective action, and must move on again to careful planning in a continuous cycle. Before beginning the PDCA process, it is important to assemble the team that will participate and develop a communication plan about the effort. Plan, Do, Check, Act cycle is the very first fundamental tool in implementing quality improvement. It mainly does 3 things. Helps you to continually change what you do in order to achieve higher quality in your results and processes. Gain continual improvement to increase in work efficiency. Allows you to clearly see which stage your project is at. Assist you in handling your work logically and systematically. Prerequisite. Assemble the team that will participate and develop a communications plan about the effort. PDCA involves a team approach to problem solving. Those involved with or impacted by improvements must be kept informed of the changes, timing, and status of the quality improvement project. It is important to establish a communication plan at the outset of the improvement effort and to communicate and post progress on a regular basis in a highly visible location for all to see. Plan. During the planning stage, the team should outline how the improvements will be accomplished, that is, who, what, where, when, and why. Do. The purpose of this phase is to implement the action. Check phase is the review phase, where all your efforts will make you move from doing reporting to doing analysis. Act. This phase marks the culmination of the planning, testing, and analysis regarding whether the desired improvement was achieved as articulated in the aim statement. The purpose is to act on what has been learned. At each step, ensure that you get the highest quality solution possible. Plan, do, check, act.
Keywords. PDCA. It refers to Plan, Do, Check, Act. Implementation. It is the act of accomplishing some aim or executing some order. Action Plan. An action plan is a document that lists what steps must be taken in order to achieve a specific goal. Further readings.